Hello, my name is Akhane. I'm a pharmacist in Halifax, Nova Scotia. I work with Rx Solution Pharmacy in Low Sackville, Nova Scotia, which is about 10 minutes from Halifax. As a compounding pharmacist, we compound the medication specifically suited for the need of the patients according to physicians or according to a lab result. As a compounding pharmacy at Rx Solution Pharmacy, with the fellowship in anti-aging and regenerative and functional medicine, we pursuing a higher level of education because we believe that this is the way to go, this is the future, because it works, because everything is based on studies and also it's evidence-based medicine, and it's also a very healthy way to do things. We compound vitamins for patients. We do some saliva tests for hormones. If we do hormones assessment, we have to look at the whole body as a functional body, not just because we see the lab, here's just balance the progesterone or the estradiol, which is not sufficient enough. We have to look at the adrenal function, we got to look at the thyroid function. We make sure that everything is balanced, your gut function, before we even start you at the bioidentical or the hormone therapy, because everything is correlated to each other. We know that a lot of people have gut issues, and a lot of time when your gut is wrong, everything else is going to be wrong. So you make sure your gut's healthy, you make sure you're detoxing properly, you make sure that you take the proper things. There's a lot of people taking proton inhibitors and H2 antagonists such as ranitidine or antacid, which is not very good for the body because it decreases the acid, and by doing that you're actually changing the gut flora, which then could lead to leaking issues with your gut, which we call it gut permeability issues, and that could lead to many conditions. That's why the first thing, anything is wrong with you, we usually like to look at the gut, make sure you got enough gut flora, make sure everything's okay, make sure you can process certain things properly. We also do one-on-one consultation with patients, from ulcerative colitis to anything from fibromyalgia or any other conditions such as diabetes. We do prevention. We make sure that they're taking the proper nutraceuticals in order to support their cellular system, so that you prevent the degradation of the cellular, or so that you pre-existing condition don't get worse. I also have patients that do have stage 3 or stage 4 cancer that are on chemotherapy at the present time, that they do need more information as to what they can do, and we can do a few things. Number one is to protect their heart or protect the kidneys so that you don't go into cardiomyopathy or kidney failure, especially with chemotherapy. So we have to talk to them and make sure that they understand what they're doing too, and give them a couple options on what needs to be done before they go into chemotherapy. We also have herbs and nutraceuticals that can help patients with panic attack and also with depression. There are natural products that can help you without going with the pharmaceutical, which can cause a lot of side effects and drug interactions, and then it can lead to a lot of other things that you don't want to do. We'll welcome any physicians and patients that would like to know about the concept of functional medicine or regenerative medicine, and you can contact us at www.rxsolution.ca or call us directly. We look forward to talking with you. Thank you.